Alrighty.
All right, so my name is Dr. Deborah Langheld. I am, how many of you have been to one of my presentations before? Okay, great. Okay, great. So this is a half and half, it looks like. Thank you for coming. You guys are new. I am a licensed primary care physician, but not in the state of Tennessee, because the state of Tennessee does not allow naturopathic doctors to be licensed. So in this state, I can only act as a healthcare consultant, so that's what I'm doing, and which doesn't really affect a lot of what I want to do anyway, because I want to help people get off drugs and I want to empower them to take control of their own health naturally. So in support of that, I also got my master's in public health at the same time I got my physician's degree, and then I also became a certified health education specialist so I could do what I'm doing right now and learn how to do that properly. So, and I'm also a licensed massage therapist in the state, which allows me to touch people, which is great for me to help them figure out maybe what's going on. Okay, so I need to get further over here.
Yeah.
Okay. All right, so let's go. So the first 6 or 7 slides, I'm just going to go through really quick. I'm not going to even talk about them. I put those slides in here, so if you're curious about what naturopathic medicine is, that you can go back when because anyone who signed in up here into the email, you'll get a copy of this presentation, and then you can read it at your leisure. But we have so much to cover today that I'm not going to talk about naturopathic medicine and what it is, except to say that 26 states and jurisdictions allow us to be licensed primary care physicians. Tennessee is not one of them. We are still doing advocacy to try to get licensed, but it's just to make sure you're clear about who I am. As a naturopathic doctor, we follow what's called the therapeutic order, and we believe in removing the obstacles to cure. So we start at the bottom and then we go up. So even a botanical medicine would be more of symptom control and not where we would start. We would start further at the bottom to try to understand what led your body to become out of balance, and then how do we create that balance. And so, and we're going to be talking a lot about that today, because chronic fatigue and fibromyalgia tends to have a lot of multifactorial causes that are preventing you from healing, and so we're going to talk a lot about the bottom of the therapeutic order. Okay, so this is just more information. My disclaimer, I'm not a licensed physician in the state, but I am licensed, just not in the state, and so I'm just a natural healthcare consultant, and be advised, this is for educational purposes only. Everyone is different and needs tailored. You need to tailor it. So if you're interested in anything you learn from this presentation, talk it over with your primary care physician to see if it's useful for you. Okay, so let's keep going. All right, chronic fatigue, and fibromyalgia. These are often lumped together, but you're going to find out there's similarities, but they're not the same. They are definitely not the same, although there's overlapping symptoms. So we're going to keep going. So this is a very simple graphic, but it illustrates it a little bit. When you have chronic fatigue syndrome, it's a diagnosis of exclusion, which means if we can't figure out why you're tired for any other reason, and you've had this fatigue for over 6 months, then you have chronic fatigue syndrome. So it's a diagnosis of exclusion. There's no defined specific criteria like blood biomarkers or something like that defines it. So that's pretty much it. So it's really difficult, and normal allopathic doctors, so that would be MDs, don't have a really clear idea of what it is or even how to approach it. So they it's like, shooting in the dark what they try to give you, and they really have drugs and surgeries what they have to offer. That's the 2 main tools in their toolbox. So it's not always very helpful, right? And if you've heard me talk before, I totally believe that we need both allopathic medicine. There's a role for allopathic medicine, but there's also a role for naturopathic medicine, and we need to see those as 2 sides of a coin, and they're both useful, right? So why would you go to a plumber to have to fix your electricity problem, or vice versa? This is the same thing. An allopathic doctor or an MD may not be the right doctor to go to for chronic fatigue or fibromyalgia, because it's just out of their training, right? It's too ambiguous, but a naturopathic doctor is perfect to go to. And so we're going to talk about a lot of things. Fibromyalgia is typified with more pain and less fatigue, whereas chronic fatigue is more fatigue, profound fatigue, and less pain. So, but they both have overlapping symptoms, as you can see. So we're going to talk, here it is again. I love this slide because it says, here's fibromyalgia. It's basically lots of tender points on your body that when you push on them, they hurt more than they should. So that's called allodynia. And so a lot of specific tender points too that are typical for fibromyalgia. So the pain is just extraordinary, and then the fatigue is a little less. It's like mild fatigue. Whereas chronic fatigue, you have mild pain, but you have profound fatigue. So that's why they're so often lumped together, but there's some different reasons. Hello, Gloria. And okay, so here's some books, and this is just me emphasizing that a lot of times they will lump them together, but we're going to talk about how you might want to approach them similarly and from different perspectives as well. Okay, so this is a little video. We're not going to go into it because we have yet, but I might come back to it, that talks about, generally speaking, what it is. So if you're curious and you want to educate yourself on what it is in a little more depth, by all means, watch the video. Today, I like to get to tangible things you can do. So I really want to focus on what can you do and less about what it is, right? Okay, but we're going to overlap. So here's another video that talks about it a whole lot. Chronic fatigue. A lot of people have orthostatic intolerance, which means getting up, they'll get dizzy, right? And those are interesting symptoms because with either of these, or with both of them, chronic fatigue or fibromyalgia, I recommend a tailored approach. So first thing that I would do if I was seeing you as a client, I would have you write down, or I would write down with you, we would explore what your specific symptoms are. And so there's like symptom checklists, and then I would tailor the treatment plan or my recommendations for you based on your specific symptoms, and because it guides me on what might be causing the imbalance. Okay, so these are interesting ones. So chronic fatigue, this is a real tiny print, but we're going to go into some other ones that are bigger, but they're talking about what are the potential possible causes, and they have all kinds of difficult words like apoptosis and low ATP, mitochondrial dysfunction, oxidative distress or oxidative stress, and then increased COX-2 and all these things. These are medical terms and we're going to go into it a little bit because it's important for understanding what could be going on in your body or someone who is suffering from this. And I'm going to summarize, and I might do a lot of repeating because I want you guys to really hear me, but I tend to, from my clinical experience and the patients I've helped, believe that it's largely mitochondrial dysfunction, which we're going to discuss in depth, and microbiome dysbiosis, which means your microbiome has become imbalanced with the diversity and the type of bacteria that are supposed to be in there, and that affects everything. So those are two big ones from my clinical experience and from the literature as well. But I've had more effective results treating people trying to balance their microbiome. So we're going to discuss that. And now if you look up a lot of the literature, it'll say cognitive behavioral therapy and a graded exercise program. They really focused on that for a couple decades, and that's now been proven false. So the most recent literature says that it's very ineffective. It doesn't help a whole lot, either of those two things. And that's from my clinical experience as well. I found that I am trained in cognitive behavioral therapy. That's one of the modalities that naturopathic physicians are trained in, but it's not helpful for chronic fatigue. And in my opinion, it's a little bit condescending too, because it's like telling you it's in your head, and if you can just change how you think, then it's going to help. And it actually has a physical basis from my experience. So I like to start with addressing the physicality of it. Okay, so a lot of people don't understand, what is saying I'm tired, is that a diagnosis of chronic fatigue? And honestly, I'm not super caught up. Like allopathic medicine, they really like to give you a diagnosis, and so they're gonna, test all these different things, make sure you don't have iron deficiency anemia, make sure you don't have celiac disease and gluten sensitivities and all these other things that they want to rule out. And then before they could say you are diagnosed with chronic fatigue. But a lot of people might just have profound fatigue, and I still think that what we're going to go over on what you can do is very, very helpful. Okay, so they talk about, the definition here. So this is like talking about the definition and what other things people can be suffering from instead of chronic fatigue syndrome that might be causing their fatigue. but we'll go through it some more. Okay, so here's a simple slide. This one I want to talk about a little bit because it has to do with how your body's processing sugar, and we're going to go into some depth on that one. And I think that has a lot to do with your microbiome, so all of the bacteria in your gut, and if you can get that fixed, you're going to fix this impaired glycolysis that can contribute. So we're going to go through it even more. Okay, so this is a huge list, and this is where I like to focus for the possible causes of chronic fatigue. And I say possible because technically there's no known cause, there's no known treatment, we don't know anything. We don't even know how to diagnose it really well. But from lots of different studies that I have read and my clinical experience, these are the main things that push someone towards chronic fatigue. And so you have to talk to each client, each patient, and know yourself to try to understand. Like, if you know you drink tons of water, then dehydration is probably not the cause for you, right? And like, let's say you know you get really good sleep. Well, then sleep is not your issue. This is why you have to tailor it, right, for each person. So look at this list and maybe put a check mark by the ones that you suspect. And I want to put a special focus on toxin exposure. This is one that I believe, from my experience, contributes quite a bit to people with chronic fatigue. And you may not know what toxins you're exposed to. None of us do. How can we know, really? It's just as we live, we accumulate toxins, and they get stored in your adipose tissue, typically. That's your fatty tissue. So you need to get rid of them, right? And you need to do it safely. And so we're going to talk about very slow, safe ways to do this at home, that you can do at home. And that almost anyone who has chronic fatigue, I recommend that you develop a custom detoxification protocol, which we will talk about all of your options for that. So that's a big one. Another big one that I want to bring emphasis to is hidden infections, and we're going to talk about that. From my experience, this is a huge one. So people will have an infection, they'll get, and I'll talk about it in more detail, but you'll get a flu, right? Or you'll get COVID, or you'll get something. And then after that, it's like, that's when things start going downhill. That's when you're chronic fatigue. And so a lot of times your body has a hard time completely getting rid of a virus, like an Epstein-Barr virus. It just gets sort of embedded in different places in your body, and you can't get rid of it. And so it's important to completely get rid of any hidden viruses that are stuck, in essence. And I've had a lot of good luck with helping detoxify people, and their chronic fatigue goes away. And I wanted to show something, and I'm just going to show it real quick here. So forgive me for a second here as I find it. Let's see here, this is it. So this is one toxin people don't appreciate, but I wanted to show it to you. So this is a tooth that has a filling in it, okay? And they're gonna rub it and brush it like you would brushing your teeth. And then what you're gonna see, that's smoke. That's the mercury that's released from your amalgam filling every time you brush your teeth, okay? And so that is a toxin that you are constantly, every single day, twice a day, if you brush your teeth twice a day, you're inhaling it into your lungs, you're getting it in your brain, and it is something you need to get rid of. So if you have chronic fatigue or fibromyalgia, I really highly recommend you go to a biological dentist, which the IAOMT, which is the International Academy of Oral Medicine and Toxicology, they have a, so that was a short video, so I can get rid of it now, hold on. Go back over here. Okay, and they will find a dentist near, slideshow, hold on, start from current slide. They have dentists that are trained in properly removing your amalgam mercury fillings so you don't get toxin exposure through the removal. Because when you remove them, you can get a lot of toxin exposure. So you really want to go to a dentist that has been trained in how to do it properly. And the IAOMT is a great website to go to. You can type in your state and you'll find a biological dentist. But that's one toxin that I have found, so, mercury amalgam fillings, but there's other toxins as well. Sometimes it's mold exposure, like black mold in your house and other things. And these are what I would call obstacles to cure. So you can eat all the right food, you can get all the right sleep, you can drink as much water as you need, you can do everything right, and you'll still be suffering from chronic fatigue if you haven't removed the obstacle to cure. And in many cases, the obstacle for your curing, right, is constant chronic exposure to some kind of toxin in your environment or in your mouth or wherever, or it can be, you have a virus that's just you're having a hard time getting rid of, like Epstein-Barr or something like that, and you need to detoxify to get it out of your system. Welcome, welcome.
Hi, how are you?
Good. So we're going to talk about all these in more depth, so I'm going to keep going. All right, so I'm going to focus right now on viruses. So this is what a virus looks like, by the way. This is a capsid, and you have the sheath and the neck, and anyway, so that's a scary picture of a virus. Research has shown that people who have chronic fatigue syndrome and fibromyalgia have higher levels of viruses in their system. So, and there's a list of them right here. These are the viruses that the research has shown is associated with chronic fatigue syndrome and fibromyalgia. So you need to be aware of it and take steps to decrease that viral load in your system, because it might just be a small chronic load, but when you add it up with other toxins in your environment, it's just tipping you over the edge for chronic fatigue and muscle pains and fibromyalgia. So and we're going to go through how to do that. So that's why I want to make sure we go fast enough. All right, so also people, they've been shown have weakened immune systems, and you can see it. You can see their lymphocytes and their blood biomarkers go up. So you can do, one of the first things I like to do is look at people's blood work and see where your lymphocytes are, see where all these, so because that'll tell me, do you have some kind of chronic infection that you're fighting, behind the scenes that might be contributing. And now the interesting thing is, a lot of people, I'll look at their blood work and it's fine. They don't have anemia, they don't have iron deficiency anemia, they don't have hypothyroidism, they don't have all the things that we would want to rule out, which is really the definition of chronic fatigue syndrome, is you don't have the typical indicators of why you would be tired, right? But here's some other, they say, potential or partial causes or aggravations, and these are some interesting ones, and this goes back to what I said at the beginning, which is mitochondrial dysfunction, and what might cause that, and so I will talk about that. So first, I had mentioned also, write down your symptoms. This is really helpful if you talk to a naturopathic doctor to really get detailed about it, like, that'll help your naturopathic doctor and yourself, if you do this yourself, try to tailor some of the suggestions I'm going to give in the next 70 slides on which ones could be the most beneficial to you, right? So really get clear on your symptoms. So that's the first one, and then like orthostatic intolerance is a big one, and it has dizziness as well as a lot of times memory issues and concentration issues and nausea. And so if you have any of those kinds of symptoms, write those down, right? Now you might be someone with chronic fatigue that doesn't have those symptoms. That's great. I would still write that down. These are the symptoms I don't have, right? Write those down, because it's super helpful for your naturopath or yourself in picking a treatment that or something that's going to work. Okay, so I have 2 pages of recommendations, and I'm going to talk about all of these in depth at this point. So this is where we get to the nitty-gritty here.
Okay. Are you going to send, excuse me, I'm sorry.
But no,
you're going to send these out to us?
Absolutely.
Right?
I send out the PDFs, and I got an upgraded camera, so you might actually could see and read them and see. So that'll be a new microphone, so my voice might be more clear, which would be great. Okay, so these are the things that I would want to work with a client who comes to me with chronic fatigue and fibromyalgia. Mitochondrial function, we're going to talk about some things. I would want to detoxify, and that's detoxify the viral load as well as any poisons from your system. And I like us, yes?
I'm sorry.
No.
The reason I was late is because my doctor, I have a squamous cell carcinoma right here. I showed it to you.
Yes.
And my doctor just recommended
niacinamide
recommended niacinamide.
Okay.
But he said that would prevent future skin cancers. And so it intrigued me to see that.
Yeah, I'm going to talk a lot about NR, niacinamide website, a lot. In fact, this is there's going to be a technical aspect of this lecture, because I want you really to try to, even if you don't remember the biomedical details, you'll at least hopefully get impressed upon you why it's important and how it could help chronic fatigue. So that's a big one, NR. That's why I have it on the top.
Thank you.
And that's the one that I like to show people is this one. This is the one I would recommend. You can look at these afterwards, and it's in the presentation as well, so you don't have to remember it completely. And then detoxification, and I'm going to talk about ways you can safely detoxify at home. And then gut health, remember I talked about microbiome. These are all my top things that I found that I've had the best results for with people if they really work on it concertedly. And then we get to diet, which is important, and sleep optimization, hydration, stress reduction, which all are helpful, but not as helpful as those top 3, right? And then more recommendations, there's ways to really kickstart your nutrition. You can do intravenous IVs, but honestly, I believe in food as medicine, so we're going to talk a lot about food, okay? And then there's supplements, and I've got a lot of supplements I can talk to you about, but honestly, if your gut's working properly and you get that optimized, you should be able to get a lot of your nutrients from food. And I don't want you to have to be taking massive quantities of supplements all the time to, get your energy back. And then there's other things like for fibromyalgia, especially whole body vibration plates. How many of you have heard of a whole body vibration plate? Yeah, those are great for pain, and especially if you combine it with red light therapy and with methylene blue, which is a biophotomodulation, which we'll talk about in more depth. But that's great for pain, so like fibromyalgia specifically, muscle pains. And then exercise therapy, that's what's in the literature, though, like I said, it's been proved wrong in some meta-analysis since then. And then oxygen therapy, which we'll talk about more. Okay, so let's talk about some nutrients, some common nutrient deficiencies. It's good to be aware. These are the top 8 nutrient deficiencies we find in people with chronic fatigue and fibromyalgia. I'll talk about this one a little bit more, but I don't want to throw too many supplements at people. So I'm not going to focus this lecture on that a whole lot. Because if your gut's not working well, even if you take the supplements, you're just going to make expensive feces and expensive pee, right? Because you're not going to absorb the supplements. So I'd rather you work on correcting the dysbiosis of your microbiome first, and then start taking some supplements. Because people notoriously, especially older people over 40, don't absorb supplements very well, right? So especially, and for a whole bunch of reasons, which we're going to talk about. But magnesium, people with fibromyalgia, I would recommend a magnesium glycinate. Right? There's magnesium oxide, magnesium citrate, magnesium threonate. There's all kinds of magnesiums, but for fibromyalgia, that's muscle pain, right? I recommend magnesium glycinate because glycinate has a glycine molecule attached, and it helps you. It promotes muscle relaxation, and it's easier to absorb without causing digestive and like magnesium citrate and magnesium oxide, they're perfect to make you poop. So if you need to poop, great, take those, right? But, and they're great for you. Actually, they'll chelate and help your arteries and 1,000 other things. I'm a huge proponent of them. But if you have like diarrhea naturally anyway, which a lot of people do with chronic fatigue, they have, gut sensitivities, magnesium glycinate is way easier to absorb, and I would recommend taking it at night before you go to bed. So you can look into that. You can look into all of these. Definitely recommend omega-3 fatty acids for almost everyone. Here's a good one that I like, but there's a lot. I'm not, suggesting any one more than others. Before you take an iron supplement, I would want to see your blood biomarkers. There's a lot of dangers in supplementing with iron if you already have enough. So don't just automatically carte blanche start taking iron supplements. I do not recommend that. Let's find out first, ask your doctor to check your ferritin levels and those kinds of things. Okay, so here's a little bit more details you can read at your leisure at the presentation of how these help with chronic fatigue specifically in fibromyalgia. And they don't even mention magnesium glycinate, so I'm throwing that one in there because that's the form that I want you to take. They also don't mention here in this list that vitamin D, I would recommend D3, and if you take vitamin D3, you absolutely must take it with K2, because they go together like this, okay? And vitamin D3 is extremely effective at many things, strengthening your immune system, resisting viruses, all that's great, but it mobilizes calcium from your food, so all the food you eat, any calcium in it is very easy to extract, and your blood serum level of calcium will go up, which is great, you want calcium, but you don't want it in your bloodstream. And so if you take high-dose vitamin D3 and you do not take K2, then the calcium has its Ca+2, right? That means it has a positive charge. It means electrically it's very sticky, and it's going to stick to your arterial walls and start clogging your arteries and significantly increase your risk of a coronary event. So you do not, over time, want to take D3 without K2. K2 is another fat-soluble vitamin. It's like the chaperone for calcium. It says, oh, look at this calcium in your bloodstream. Let me take your hand. And it takes the hand of the calcium, it sticks to it preferentially, and it will take it to where you need it, which is your bones. right? And another thing about K2 that's really great is it will chelate it out of your arterial walls and out of your kidneys if you have kidney stones and all those things. It will slowly over time pull calcium from places that it should not be and put it where it's supposed to be, right? But yes?
Does it happen to work on uric acid? Or?
Not uric acid stones, no, only calcium oxalate stones, but it's good for kidney stones if they're calcium oxalate stones. Yeah, it's basically for calcium. This is a supplement right here that by Da Vinci, but there's several brands, so I don't care about the brand, but this is called Da Vinci Laboratories, and it says ADK. So that's a whole other lecture I can go into, but really it's a triumvirate. You want D3, K2, and A. They all go together and you need them in the right ratios. This supplement gives it in the right ratios. So that's what I recommend if you're taking D3, is just take an ADK combination. Then you don't have to worry about making sure all the right ratios are there, and you're not going to accidentally risk increase your risk of a coronary event by trying to be healthy, right? So that's why supplements can get tricky, and I don't recommend taking tons of supplements because you think you're doing a good thing and you might be over time causing something bad to happen. So that's the only things I want to mention. Vitamin C, I recommend for sure a plant-based vitamin C. The literature, if you Google it, it's going to say ascorbic acid's the same, doesn't matter. Clinically, from my experience, plant-based vitamin C works about 100 times better. It's amazing how much better plant-based vitamin C works. So like here's the one that I recommend for people. It's pretty inexpensive online, but you can get them different plant-based vitamin Cs. They work a lot better to heal your endothelial lining and a million other things. Okay, so we're going to go on. All right, so this is a big one. So a lot of literature that's current right now talks about how polyphenols help people with chronic fatigue and fibromyalgia a lot. And so that's super interesting to me, and it makes a lot of sense. And so I'm not going to go into too much of the biochemistry, although I'm going to scare you a little bit, but you'll see that here's two studies you can look at, just Google the titles and you can read them if you want. But polyphenols as possible alternative agents in chronic fatigue. And this was a review, which means they're taking all the literature that's out there and they're reviewing all of it and giving you their conclusions. And it's pretty hopeful. It was exciting for me to read, and this was published in September of 2022, so it's a fairly recent study too. So what is a polyphenol, okay? So, polyphenols is a type of chemical constituent that's in plants, different kinds of plants, but there's a whole bunch of subcategories, okay, of polyphenols. All these, so chalcones, flavones, flavonols, flavones, flavonones, isoflavonoids, and anthocyanins, right? These are all subgroups under the polyphenol category. I really like this one, anthocyanins. They come from dark berries, typically, and they have a whole bunch, besides even chronic fatigue, they are great for your eyes, so like reducing macular degeneration, but mainly for your heart. Super, super healthy for your arterial walls. So like my father, he has heart issues, and that heart issues run in our family, so we I think I have a picture of the next one. We take this fruit anthocyanins, 1 tablespoon with sparkling water every single night, and it's delicious. Like we call it our nighttime berry cocktail, and it's delicious. It's using food as medicine. It has all of these berries in it in a very high concentrate, and that's a great way to get your anthocyanins daily, because you can't, Bill Mitchell is the doctor who invented this particular concentrate. And he said you can't be a berry dabbler. All the research shows that if you want really good effects from berries and dark berries and anthocyanins, you have to do it daily. So it's really hard to eat blueberries every single day. You might tell yourself you do, but it's twice a week or something, right? Well, so that's why in our family we made it a habit of just, drinking as a little cocktail, sparkling water, our berry anthocyanins. Okay, but let's go back a little bit. So that's this category right here, right? Anthocyanins. And then this is another one that I want to talk about, because these are both ones you can easily get into your food if you figure out ways to do it. But also, I'll go back a slide, if I can. It's in many other foods too. So you can do some research on your own, foods highest in polyphenols. I'm just going to tell you the ones that I have found are helpful and that are like 2 for 1 special. If you take the berry anthocyanins, you're going to get a lot of heart health, eye health, and you're going to help with your chronic fatigue, which is why I chose those. Okay, so we're going to keep going. So here they are. So why? So this is a really basic slide, even though it looks complicated, but we're going to get even further down the rabbit hole. But the the polyphenols come in through the lipid membrane, okay, and basically they quench, which is, I always think of in my head, you know, one of those blacksmiths, and they're hitting, and they get the metal hot, and then they put it in the water, and it quenches it. And that's what I always think of when I think of quenching. But that's the word that's used in the medical literature, that these polyphenols quench reactive oxygen species. So that's all of the oxidation that's happening, which it's been proven that people with chronic fatigue and fibromyalgia have a very high oxidant load for whatever reason. Well, in my mind, as a physician, when someone has a high oxidant load, I'm thinking they have a chronic infection they're fighting, or they have toxins that they're constantly exposed to, like perhaps their teeth, right? So their body is constantly trying to fight this high reactive oxygen species in their body, which is why I focus on those first, and helping their liver work good to get their liver to detoxify naturally and those kinds of things. But the polyphenols are going to help basically regenerate the oxidation and reduce everything so you can then oxidize again. So the whole thing is trying to, our body regenerates. So like we have glutathione, once we use the glutathione to quench an reactive oxygen species, you need to regenerate it so that way you can use it again, and that's what we do. So that's what this is allowing, is it's allowing your natural body's processes to fight off the high oxidant load. And it works really, really well. Anthocyanins and then chalcones, which we're going to talk about. Okay, so let's keep going. And it also, they say here, it's anti-aging, it helps your skin look younger, all of those things. I care less about that, but I love how they heal the endothelial lining, that's the lining of your blood vessels, and makes your blood vessels less sticky so that calcium that we're talking about won't stick to it, right? And so like heart health is super important because heart disease is still the #1 killer, so I'm always going back to the heart, and anything we can do that supports the heart and other things, that's what I go for. Okay, so that's what I use. Now this is worth mentioning, homeopathy is another modality that we're trained in, and some people react really, really well. They respond really well to homeopathy. I'll say it's something I've had mixed results with, but if you know you're a person who responds well to homeopathy, these are the ones that I would consider, these 5. And like, especially, let's say you have a very hard time sleeping, this one, number 5, coffee cruda, is one that I would recommend trying. It might help you sleep, but a lot of people who are having problems sleeping with fibromyalgia, it's because they're hurting so much. It's not because they're restless, right? So read the descriptions, and if one of these descriptions sounds like it fits you to the T, then you might want to go ahead and try one of those homeopathic remedies. It's not going to hurt anything for sure. Okay, so now we're going to go talk a little bit more about the microbiome, right? I talked about how this gut dysbiosis contributes a lot, the research shows, to chronic fatigue, and it's mainly for a variety of reasons. There's inflammation in your intestines, and so it causes like a leaky gut, which is the cells that line the intestinal wall start separating when they're inflamed, and then food particles and things that are normally too big to get out. You can increase your allergies, and it increases your inflammation even more. You become allergic to foods and sensitive to gluten and sensitive to dairy and sensitive to foods that you've never been sensitive to before, and that's all because the walls, the enterocytes that line the intestinal walls start separating because they're inflamed. So you need to reduce the inflammation, heal that gut lining, fix the microbiome, and so here they talk about how this study provides new insights into chronic fatigue syndrome pathogenesis, that's the reasons why, what could be causing it from a pathology standpoint, and understands the relationship between disruption of the oral microbiome, so I'm going to talk about your mouth, the microbiome just in your mouth, and may lead to improvements in treatment and diagnosis. So it's not only your gut microbiome, but your mouth, your oral microbiome contributes to your chronic fatigue syndrome. So that's something, a little bit of new information. And there's specific bacteria. I don't like to focus on that a whole lot because there's ways to fix that. So let's talk about your mouth right now. As people who've heard me before, I'm a big proponent of your oral health, contributing to your heart health. And so one of my next lectures here actually is going to be on oral health and the link between oral health and heart health, because oral health is so important. But so if you want to hear a lot more about oral health, come to my next lecture next month. But for now, I want to mention, it has been shown that xylitol helps balance the oral microbiome in your mouth. So I'm a huge proponent of xylitol. A lot of gums now have xylitol in them. It's a sugar alcohol, and most sugar alcohols like sorbitol and other ones, they they cause a digestive distress. So I don't recommend eating them, like buying the powder and eating it, like, and so substituting your sugar with it. But having it in gum is okay. Now, if you chew, 10 hours a day, you're chewing gum, that it could eventually cause digestive distress, the sugar alcohol. But if you only chew gum for 5 or 10 minutes after a meal or something, that's fantastic. Really fantastic. I highly recommend it, because the xylitol breaks the biofilm on your teeth where the bad bacteria like to adhere, so it'll break it and disrupt that biofilm and allow you when you brush your teeth to get rid of it, okay? And then the good bacteria that you want in your oral microbiome will start proliferating, because they have a bit more of a chance because the bad bacteria is gone, right? So really, really helpful. A side note, if you've seen my lectures before, I talk about how they've done a DNA analysis of the plaque in your carotid artery, and the DNA of the bacteria in your carotid artery, okay, is the same as your mouth. Okay, so the plaque buildup that happens in people's carotid artery, which if it happens in your carotid, it's also happening in your coronary arteries, right? So it's from your mouth. So the bad bacteria from your mouth, if you have periodontal disease and you have bleeding gums and those kinds of things, that's an open wound in your mouth when you have bleeding gums, and that bacteria in your mouth goes straight into your arteries and starts creating an inflammation of that endothelial lining, and that calcium and all the other will start sticking to it, right? It makes, the inflammation makes your arteries sticky, and that's what you don't want, right? So number one, don't have bleeding gums. We'll talk about that more in another lecture. You can go back to my other lectures and hear what I say about all that, because I go into a lot more depth. But for now, for chronic fatigue syndrome, they've shown your oral microbiome, when it's not healthy, contributes to chronic fatigue, because this is the gateway to your health, is your mouth. And it's been underappreciated, I think, in medicine. So we need to really pay attention to our mouth. So I recommend chewing gum for sure after your meals. If you have chronic fatigue, it's not going to hurt anything. Chew a piece of gum after your lunch, after your breakfast for 5 minutes. It's not going to hurt anything. This is another thing that I recommend people, and I use it myself occasionally. It's called Pro Dental, and you can chew on these little chewable tablets and then let it dissolve in your mouth with your saliva and then swish it around. Periodontal disease and bleeding gums and gingivitis definitely, believe it or not, I've done my DNA analysis, because I am a certified nutrigenomic person who can do your analysis for you. But in my family, for my DNA specifically, which is my twin sister and I, we have a very high genetic predisposition towards gingivitis and periodontal disease, and my twin had to have antibiotic shots in her gums. And so then I got her on my oral protocol, and she's now regenerated her gums, right? So now she does, it's completely, and they say you can't regenerate, and hers are all over there. The dentist couldn't believe it. So there is, if you're interested, ask for my protocol. It works really well. It's all natural, but one of the components is to restore and to heal the oral microbiome in your mouth, right? And that means using xylitol to kill the bad stuff, and then repopulating it with the good stuff, right? Yes?
What kind of toothpaste do you recommend?
I use a toothpaste from India called Herbodent, and you can get it online on Amazon, and it's very dark green. You only need a little bit, and I get it in like 6 packs, and I'll talk about that at my next lecture. Herbodent. And it has herbs, and I'm a naturopath, so I love herbs, and it has no fluoride, because I'm highly against fluoride in any form whatsoever, and that's one of the toxins I list that you should stay away from. The IAOMT, the International Academy of Oral Medicine and Toxicology, has a whole paper on fluoride, and that includes topical application, because your mucosa in your mouth, that's this, all this, mucosal lining is highly, it's one of the mechanisms we use to absorb things into our body and bypass our digestive system. So if you paint your children's teeth with fluoride, which they will do at school without even asking you as a parent, they will absorb it through their mucosa, bypass their digestive system, which is, that's how we take toxins out of our system, and it just goes straight to their brain. And so it's not good. Even the topical application is not good. That's a whole other story, though, and I'll talk about oral. It does change the bone structure. It makes your teeth, the enamel, 4 to 7 times harder, but that has not been correlated or associated with the reduction of dental caries, which is interesting. So let's say, oh yes, it makes your teeth harder. That's true, it does. It makes the enamel harder, but it does not reduce your risk of dental caries. That's cavities, so it's crazy. So anyway, I'm against it, but you don't believe me. In fact, I would ask you not to believe anything I say in this lecture and to please go down the rabbit hole and research it yourself. Here are some great books. How many of you have heard of oil pulling? Okay, great. That's awesome. So oil pulling, I use it probably once a week now, but if my gums start bleeding, start doing it every day. And I use coconut oil. You can use sesame oil. So Indian medicine is called Ayurveda, and they use sesame oil. But I like coconut oil because it has a added antibacterial component. And I use a little tiny spoon, a little mini spoon, right? And I just scoop it right out of my coconut oil container. And then I have a little container of xylitol powder, and I dip my spoon into the xylitol powder, put it in my mouth, let it dissolve, swish it around for 10 to 12 minutes at least, which is a long time. Your saliva will make it more, so if you get too big of a spoonful, you're gonna find your mouth is too full, so I highly recommend a small amount. Swish it around, don't spit it into your shower drain or your sink drain, because it's hard at room temperature, and it will clog your drain, so spit in the trash can. So when I do get in the habit of using this, like because my gums start bleeding for some reason, I put it in my mouth before I get in the shower. Then I take my shower, and while I'm taking my shower, I'm swishing it around. And then when I get out of the shower, I spit it in the trash can, right? And that's a great way to get your 10 minutes of swishing it around. But it will help tremendously on healing your oral microbiome. So it's something that's, like I said, it's a 2-for-1 special. It's going to help your heart, but it's also going to help with healing your oral microbiome for your chronic fatigue syndrome. Okay, so now we're going to talk a little bit about fibromyalgia. This one's more about pain and specific tender points, and it really affects people's sleep. When I was in medical school, I lived with a woman who had chronic fatigue, but mainly fibromyalgia. It was overlapping symptoms, so largely fibromyalgia, and I can tell you her tender points matched exactly the tender points that are typical for fibromyalgia. She would have to put heating pads around her back right here, because a lot of the neck and upper back right here is where they hurt, and it's like just a little bit of touch would make her be in pain, and it prevented her from sleeping because she couldn't even lay down without being in pain, and nothing was wrong with her, right? That's, all the blood tests, everything, they say nothing's wrong with her. And that's sort of what got me into learning a little bit more about chronic fatigue and fibromyalgia, was living with her through medical school. So irritable bowel, this is one, if you have like a very sensitive bowel, an irritable bowel, write that symptom down, because that to me would indicate we really need to focus on your microbiome of your gut. Like that would be something we would focus on for you. If you don't have dizziness, write that down, because then I wouldn't probably do some of the other treatments that we have. So like definitely all these different slides, I would take notes and write down your symptoms so you can talk to or at least evaluate the next things that I'm going to show you on whether or not they would be good for you. Another thing worth mentioning for fibromyalgia is drug interactions. So a lot of us now, when we're 50 and older, take statins, and statins can cause myalgia, especially over time. Myalgia is a muscle pain, not for everyone. I mean, chronic fatigue and fibromyalgia, they're very hard to say this is what causes it. So, but if you are on statins, and that would be something I would ask, and you have fibromyalgia and chronic fatigue, I would have you start taking CoQ10, because it becomes depleted. There's a book called Drug Muggers, and I love it, and you can look up all the drugs you're taking and what nutrient deficiencies result over time having taken those drugs. So, for statins, it's CoQ10. And so if you look, and you're going to learn a lot more about this because I'm going to go into depth on it. I didn't bring my pointer today, but if you look right here, the red one, the red oval ellipse, that's CoQ10. And what you're looking at in this picture is our electron transport chain and oxidative phosphorylation, and that's how we have cellular respiration. And all these are complicated words, but it's how we create energy. In chronic fatigue, you don't have any energy, so there's something wrong with how you're creating energy. And so the first thing as a physician I think about is if you're not creating energy, something might be wrong with your cellular respiration, how we create energy in the oxidative phosphorylation process, which typically is this specific electron transport chain. There's some kind of dysfunction happening here. So people who have myalgias from statins, it's because CoQ10 has been used up because of the statin. And so we won't go into pharmacology, but basically you don't have any, and so the process of transporting electrons that results in ATP, which is energy, gets interrupted. So this is a great one that we get from Costco, you know, and it's a CoQ10 that's in the reduced form, so it's more bioavailable, so it's a great one. But there's other CoQ10s that are great as well. Ubiquinol is the reduced form, so that's the form I would recommend of CoQ10. You can get it in 2 different forms. Okay, so we're going to keep going. So, and there might be other drugs, so like write down all your drugs and make sure, you know, you look up in the drug mugger's book, you know, and you can get it on Kindle, you know, if any of them are depleting a nutrient that you might want to take a little extra because you're taking the drug. All right, so here's a little bit, and here's the source down here, and you can read this whole PDF that talks about how statins deplete CoQ10 out of your body, and some of the symptoms that are varied, but the main one's myalgia, which is muscle pain. That's the main symptom of taking statins, is muscle pain.
Has a statin ever saved anyone's life?
That's a very controversial question, and you know, next time I come, I'm talking about oral health and heart health, so we're going to talk a lot about the heart, and I will go into depth on statins a little bit more and show some of the research. I am not a proponent of statins. Now, some research says that it can help because it reduces inflammation in the body. So that I might agree with a little, that you know, if you have very high inflammation for other reasons, right? Maybe you have high toxins or a viral load or something, then statins can reduce inflammation. And when you reduce inflammation in your body, then your arteries are less sticky. And if your arteries are less sticky, then you don't have calcium and, you know, plaque buildup, and then it'll reduce your risk of a coronary event. And that logic makes sense to me. But I believe personally that there are safer ways to deal with and manage chronic inflammation in your body. And number one is remove obstacles to cure. Find out why your body's inflamed and get rid of the inflammation naturally, you know. But anyway, that's a whole other topic. Okay. This is a MD, so a regular doctor, MD, and he wrote a book called From Fatigue to Fantastic. His name's Jacob Teitelbaum, and he's had a lot of really good luck, so I've watched a lot of his YouTube videos, and I've read his book, and it's interesting to me. It's very basic, but it's a good way to if you're just starting trying to deal with your chronic fatigue. These are great ones to look at. So make sure you're getting good sleep. That's a catch-22 though, because you might not be getting good sleep because, you know, you have fibromyalgia and there's pain. You know, there's or even chronic fatigue. You have mild pain. Hormones is a big one. You want to make sure you don't have any kind of diabetes or pre-diabetes. You want, and we're going to talk about glycolysis here soon, and you want to make sure your thyroid's working well. So there are some hormones I would want to like check off and make sure, or I would want to look at your full blood work panel and just take those off. But the main one is diabetes is associated, and that's considered an endocrine disorder, which is hormones, right? I mean, insulin is a hormone, so we need to make sure you have proper insulin response to your food. And so I might have you use a blood glucometer for a while and make sure you're not having high highs and low lows. Even if you're not officially diabetic, you might be veering in that direction, and if we can correct that, that might help your chronic fatigue. And then there's immunity, and this one I'd like to even replace the immunity with infection, right? Like a chronic hidden infection. It's these viruses that are in your system that we need to get out. And they talk about that underlying viral, bacterial, bowel, sinus, and yeast infections like Candida has been associated with chronic fatigue. So there's a lot we can do. So we're going to keep going. Exercise. This is a difficult one because if you're hurting and you're tired, it's really hard to exercise, right? And they've shown, like I said recently, that this graded exercise therapy is less effective than they formerly thought, right? And then nutrition, we talked about that a little bit, and they're repeating a lot of the ones that I said. Okay, so we're talking about sleep, but these studies mainly show that fibromyalgia makes it impossible to sleep. And that's, sort of obvious to me because you're hurting so bad, it's really hard to get comfortable to sleep. So that's a tough one. I have in my YouTube channel a whole lecture on optimizing your sleep. And if sleep is an issue for you, please watch that one because I literally talk for an hour and a half about how to optimize your sleep. And you'll find at least a couple tips in there, but I'm not going to go into it now because I have that in my other lecture. Okay, so this is one I wanted to mention because I have had a lot of good results with it with other patients who've had and clients who've had muscle pain, like idiopathic, meaning we don't know why, muscle pains. They have now found a link between fibromyalgia pain, which is muscle pain, and an excessive amount of fascial adhesions. So, when I was doing my gross anatomy course, in medical school, we had to dissect a cadaver, right? And it was really interesting because, it's not just you cut the skin and then there's the muscle. There's usually this white layer, and if you've ever, gotten a whole chicken and had to prepare it, you'll see the white, filmy layers. That's your fascia, right? And the fascia connects everything. And as we get older and we have stress on our muscles, like especially if you're like a lifelong athlete, your fascial adhesions get damaged because they'll get pulled because you'll pull a muscle or something like that. And then you want to repair, so your body will repair it by making more complicated fascial adhesions until finally you have lost your mobility of those muscles, right? They don't slide back and forth the way they should. And so a perfect example of this would be plantar fasciitis. How many of you have had something like that, right? Yeah, I have it right now on my right foot. And I'm working on getting rid of it, but it's something I have a tendency towards. And that is a fascial adhesion, right? And it causes pain. Like when you get up with plantar fasciitis, your first step out of bed on your heels, like, oh my God, that hurts. And that's a fascial adhesion that causes that. So it's because you've pulled the muscles and the origin and insertions of the muscles. You've pulled that tendon and that ligament, those ligaments, and it causes damage on a microscopic level to that connection. And then your body puts more fibers there in all different directions, not in a linear direction, but in all to try to protect you from the injury. But then once the injury is healed, then it's like, okay, now you need to dissolve that scar tissue, and you don't, and so now your foot hurts, right? Okay, you have to get rid of it. So like one of the best ways to get rid of plantar fasciitis is to use a sharp, like I use a knife, like the knives that have I call them like a butter knife that has just little tiny serrations on one side, Okay, you take that, but you don't use the serrated side. You use just the sharp, soft side, smooth side. And you take your foot and you literally go like this. You comb the fibers right at the base of your heel and you dig as far in until tears are almost coming out of your eyes, right? And you can put a little lotion on your foot to do it. And so while you're watching TV, just push down and you'll feel what I call the crunchies. Right? That's the little fascial adhesions, and you're combing them out. You're combing those fibers out. You're getting rid of that scar tissue. And then after a couple sessions, if you do it hard enough and you can grit your teeth and bear it, you'll be able to walk, and then the plantar fasciitis goes away. And I've also helped people with their IT band on their side of the leg where the doctor said that they were going to have surgery in their knee. And I'm like, you don't need surgery in your knee. You just have scar tissue in your IT band because I'm a massage therapist. I can palpate and I can feel it. And so we used cupping therapy to get rid of her fascial adhesions on her IT band. And it was very painful, because you have to break the scar tissue, right? And so you can do it several different ways, but you push, to get the suction, and you put it on your skin, and then you just pull like this, and it's called gliding cupping therapy, right? And then you want the suction. There's sometimes you have to redo the suction, and then you can feel the scar tissue, and you'll know when you go over the scar tissue because it hurts when you go over the scar tissue, right? And so then you might have to take a breath and like do less suction, and do linear along the muscle fiber length first, and then after a while, when this becomes more tolerable, so after a week or so, if you're doing it every other night, sometimes I want you to have 2 nights rest so your body can heal, right? Because you're ripping the scar tissue up, right? But you want it to be linear, so that way the muscle fibers slide back and forth. And so eventually I have people do cross fiber, right? And so they'll go home, and then after a while, the IT band, the scar tissue's gone, and this person was walking up and down the stairs, and they couldn't, they thought they were about ready to have surgery, and all they needed to do was break up the scar tissue in their site. Now, so similarly, analogously, this unexplained idiopathic pain that people with fibromyalgia have, a lot of times they respond very well to cupping therapy, right? So you can get them on their backs, and you can do that and try to slowly, and you can use different suction levels, right? So you can start really low, and then they can respond. Sometimes they respond. Now, this is all potential. So I'm giving you guys, I'm starting now, and I got 7 or 8 minutes. We're going to go through a lot of possibilities here, but it's not it's not a curative. These are just something that may work for you or it may not. Like, you know, you need to sort of tune into your own intuition, you know, your own body, and then, you know, experiment with a few of these, and hopefully, you know, something will work. Yes?
On the cupping thing, is there a certain place you have to do the cupping?
Yeah, on the muscles that hurt.
Oh, okay.
Yeah, yeah. So, like with plantar fasciitis, you know, I would go to the heel that hurts and, you know, dig right into the origin of that muscle, and you'll know because it's crunchy. Like for that one, you can feel it. Now for fibromyalgia, a lot of times it's like the neck back here and the levator muscle, which attaches to the medial side of the scapula and goes up to 4 points on your neck. So levator is a big muscle, and that one you're not going to be able to do that on your own. You would need to have someone do it for you, you know. And it could hurt, so you would probably want to use, you know, real light suction at first, right? And just glide, and you want to glide slowly back and forth, up and down the direction of the muscle. And so this would be like from the neck down to here, and just go like this, you know, and keep going down like that. And, you know, seeing a massage therapist who knows how to do cupping therapy would be helpful. But you can have your, you know, significant other or housemate do it for you. That would work too. So that's one, and you can read about it. I have some links here that talk about the fascial. And so myofascial release specifically has been shown to be way more effective for fibromyalgia compared to just normal massage. So a normal massage is not that effective, right? I mean, it might feel good in the moment, but it's not going to long-term help get rid of the fibromyalgia, right? But myofascial release, which is the release of these adhered fascia, has been proven through medical studies statistically significant in helping, okay? So that's why I mention it. Okay, so now we're going to talk about iron deficiency anemia can be a cause of chronic fatigue, and so, but it also so a possible association between fibromyalgia and a decreased ferritin level. So this is just me emphasizing, get your blood work done, have someone read your blood work who knows what they're looking at, right, to make sure that that's not the case. And then also they're talking about here, this study indicated that a ferritin level over 40 is required to replete, that means fill up the mitochondrial iron reserves as well as your blood requirements for your, so it says they're, you know, both primary targets of iron stores. So it's once again going back to your mitochondria. You want to make sure your mitochondria has all the things it needs to create that ATP during its electron transfer chain that we're going to talk about more. And then glutathione is great because that's what, it's also one of those quenchers, you know, just like the polyphenols quench the reactive oxygen species, so does glutathione. And so the one for chronic fatigue people that I like to recommend is a liposomal liquid glutathione, and you just put a couple squirts under your tongue and you hold it in your mouth for about 5 minutes if you can, and you let the mucosa of your mouth absorb the glutathione. This is important because you don't want to swallow it because your immediately, because your digestive system will actually has enzymes in it that counteract the glutathione, right? So oral glutathione is like in capsules is notoriously ineffective because although there is one form out now that's looking like it's better, and I can talk to you about that, but this is the better form that works a lot better. It's a basically sublingual. You squirt it in your mouth under your tongue, you hold it and let your mucosa absorb it, and it works. You'll see studies have shown that the blood levels of your glutathione go up. You can detect it more. So that's the one I recommend. And it helps aid in the repairing of cellular metabolism, which is exactly what we're talking about doing. Okay.
So that replaces taking an iron supplement?
No, that was sort of, I just put two different things in one slide. You know, these two are talking about iron, this is talking about glutathione, and I just threw them in one slide because I didn't have any pictures. And I wanted to make sure I mentioned it, so, but sorry about that.
Is that off Amazon?
You can get it off Amazon. You know, I order a lot of supplements for my clients, and I can get a huge discount through Emerson. And I like getting it through Emerson Ecologics a lot better because sometimes, although I can't prove it, but they say that when you buy things on Amazon, you don't know for sure if the pills have been replaced and repackaged, right? Emerson does frequent, it's for physicians and naturopaths, it's a supplier, and they test everything. So I trust them better, you know, if you're gonna spend a crap load of money, you know, on supplements, it's nice to know you're for sure getting what you paid for, right? So I prefer to buy it through Emerson, even for my clients. You know, if you've seen me, then I offer my services to buy it, and I give you my full physician's discount, which is most of the time 50% off. So, and that's just a perk of coming to see me. But otherwise, yes, you can buy it from their website. This one's Designed for Health, and you can buy it from their website or Amazon. You know. And you're supposed to keep it in the refrigerator. It kills me that I don't have it in the refrigerator right now, but I wanted you guys to see it. It definitely needs to be kept in the refrigerator. Okay, so let's keep going. Here's some more supplements. Phosphatidylcholine and phosphatidylserine I really recommend for people who are trying to get themselves back into balance, especially if you have that orthostatic intolerance and you have dizziness and brain fog and all those brain symptoms, you know, then this is something that I would want you to take as phosphatidylcholine or phosphatidylserine. It helps a lot with those kinds of symptoms. So that's why I said you need to write down the symptoms you have and then tailor your approach based on your symptoms. Okay, so now we're going to talk about some other things. So this is more, well, this is not just symptom control, and I have the DMSO right here. You can take a look at it and smell it, but that has been shown in a lot of studies to help alleviate osteoarthritis symptoms. And so like if you have osteoarthritis in your fingers or your toes or your knee, you can rub it in, and it's been shown to help dissolve fascial adhesions because it has a sulfur component in it. And the MSM is the same way. So here's tons of words that say what I just said. DMSO. If you go to an allopathic doctor, an MD, and say, what is DMSO used for? They only know it to be used for one thing, and that is if they have a medicine that they want to put on your skin that's a topically applied medicine, they'll put DMSO on first sometimes, and then put the medicine on, because DMSO will help the absorption transdermally through your skin. So that's how they are familiar with DMSO. But we have now found that DMSO just by itself, because of that sulfur component, helps dissolve fascial adhesions and helps joints and ligaments repair and rebuild. So like you have knee pain and those kinds of things. I will mention one thing. Some small select amount of people are sensitive to it. I've only known one person so far, my mother, but she did get a little rash from it, so she can't use it, right? So just be aware if you start seeing a rash, it starts itching, then you need to stop using it. Now, she can use it, I believe, on your hands, right? You can use it on your, like she has some hands, and she'll rub it in while she's watching TV at night for some osteoarthritis in her hands, and it won't, but she tried using it for her hip, you know, for her sciatica and stuff, and it caused a little bit of a rash back there. But most people don't have any kind of reaction like that. Like there's so few of that that's not even in the literature that that's a side effect. But from my experience, there is, yes.
And it also helps neuropathic pain.
Yes,
I'm all over
it's
that.
real. So put it on your feet, you know, rub it in your feet. That would be great. I've had really good results with this with people with pain. And it, like I said, it's not just a pain reliever, analgesic, but it also can help, you know, heal some of these joint issues, you know, osteoarthritis, and it can heal ligament issues because of the sulfur in it. So anyway, so that you can look into. Here's a bunch of, I have 5 or 6 different references here for you to go down that rabbit hole if you'd like. Like I said, I'm trying to give you guys a bunch of different things to look into, and I can't talk in depth about all of them. Okay, but MSM cream's a great one too. Like this is, if you're sensitive to the DMSO, the MSM cream is something you can get on Amazon, and it works really well too, and it has that sulfur component. Okay, so let's keep going, and you can look into that more. Okay, this is one I definitely want to mention, and I may have to quit because I've run out of time. I didn't do my time management well today. But hypochlorhydria is a big thing that happens with a lot of people with chronic fatigue, and it's low stomach acid. And a lot of us, as we get older, I'd say most of us, as we get over 45 or 50, we have chronic low stomach acid. And one of the biggest symptoms of that is heartburn. Like you'll have heartburn a few hours after you eat. And so then you'll start taking stomach acid suppressors like Pepcid and some other famotidine and other things because you think, oh, I have heartburn. And actually you have the exact opposite issue. It's not that you have too much stomach acid, you have too little, and that's what's causing your heartburn later. But if you have low stomach acid, that means you're not breaking apart your peptides, your protein chains, you're not absorbing your B vitamins, and so it will cause joint pain and all kinds of things because you're not absorbing what you need to from your food. And so this talks about it. It also messes up your whole microbiome in your gut, which means another reason why you really want to get your stomach acid working. And so here's a little slide that talks about why we need stomach acid, right? You do not want to suppress your stomach acid. I'm going to repeat that. Do not suppress your stomach acid. Don't take Tums. If you're taking this kind of stuff, a stomach acid suppressor, you need to learn how to get off of it. And that's one of the things I do as naturopaths. I help people get off of their stomach acid suppressors and not have heartburn. And the number one way to do it, I'm going to tell you how, is to, before your first bite of protein in a meal, take apple cider vinegar. Okay, you can get apple cider vinegar gummies, so take 2 or 3 of them, or you can do like a shot glass, put 1 or 2 tablespoons of apple cider vinegar, put some water in it, and then just down it real quick before your first bite of protein, right?
Bill, you told Bill about that.
Yeah.
And we went to doctor's 2 weeks ago or something.
Yeah.
And told her about what you said, and she was highly impressed. It works.
Yeah, and most people, that's good. And another thing that works is if that doesn't do anything, like if you haven't found, come see me, and there's a protocol I have to dial in exactly how much increased stomach acid you need, or supplemental acid that you need to take before your first bite of protein. Some people, even if they took a whole cup of apple cider vinegar, that wouldn't be enough to get their stomach acid proper. So there's ways I have a whole protocol that tells you, okay, for this meal I want you to do, 2 tablespoons of apple cider vinegar. If you feel burning in your stomach, then you're good. Okay, if you don't feel burning, then you haven't taken enough. So then the next meal, I want you to take more. Well, if you get up to like 3 tablespoons of apple cider vinegar and you still don't feel a slight burning in your stomach before you've eaten your first bite of food, then that's not enough. Apple cider vinegar is too mild for you. And then what I'm going to want you to do is take a betaine supplement, which is this one right, hold on, up there. So that one, right? And I would have you take betaine HCl, and then if you take one of those and you don't feel a burning in your stomach, it's a mild burning, it's like a warm burning, then I'd have you take 2, then 3. I've had people have to take up to 7 betaines before they felt that burning. But then once it's burning, right? Then you back off by 1. And then what happens is you'll start absorbing your thiamine from your food. You'll start absorbing the cofactors in your food that are required to make your own stomach acid. And then a week later, you're going to take your 6 betaines and it'll burn. Fabulous. Now back it off by 1. So what happens is slowly over time, you can back off your supplemental HCl, hydrochloric acid, because now your stomach's creating it on its own. So this is not like forevermore, you gotta take, all the stuff. It's until you can get your stomach creating its own stomach acid. So let's go back here. So stomach acid, now we've got chronic fatigue is in the list, which is why I wanted to mention it. That's something I always look into is hydrochloric acid, because it's a huge a reason why you might have chronic fatigue. And I've mentioned heartburn because to me that has to do with that's the biggest symptom of having not enough stomach acid before your protein. Okay, so apple cider vinegar, here it is. You can get gummies. Another thing I would recommend if it's a stomach acid issue is you can spray in your mouth using the spray right here, or you can put a dropper full of digestive bitters, and that will stimulate the bitter taste on your tongue of these herbs, stimulates your gallbladder to release bile and your stomach to start creating stomach acid on its own. So it's a way to kickstart your body to create its own stomach acid, and it works great. I used to take this with me and have it in my backpack and use it at school when I was in medical school all the time. I love bitters, they're great. They work really good for me. But that's another thing, and I even make my own. So this is a book that tells you how to make your own if you have some dried herbs, but people aren't as crazy as me. Okay, so now we're going to talk about, if anybody who needs to leave, please leave, because I'm running over, but I've got a few more slides left, and it'll probably take me another 10 minutes, so leave if you need to, I will not be upset. Okay, so nicotinamide, we talked about NR, and I said I was going to go into it a lot more. So I'm going to go quickly. Here is the NR pathway. You're like, that doesn't mean anything to me, Deb. No problem, I get it. But the point with this slide is NR, nicotinamide riboside, is the precursor to NAD+. That's the whole reason I have that on here, is it gets converted in this biochemical pathway to NAD+. And who cares about that? Well, I'm gonna get to it. When you eat food that has glucose in it, it goes through this is what we learned in medical biochemistry. We have to memorize all this. Yeah. Okay? And I'm not kidding, this is the beginning. And so this is glycolysis right here. So you eat glucose, and the whole purpose of what's going on here is that you have a pyruvate. You need that to get ATP, okay? So that's what that's for. And studies have now proved that people with chronic fatigue syndrome have an impaired glycolysis. They are not able to create pyruvate from glucose when they eat it, okay? And you're like, who cares? Well, I'll tell you where pyruvate is. So this is another thing we memorize in medical, so I'm giving you the crash course medical biochemistry. But the main thing I want you to look at is, if I had my pointer, the very top right there is pyruvate. So you gotta have pyruvate to do the citric acid cycle, and that's what creates ATP. That's how you get your energy, right? So if you're not getting the pyruvate from glycolysis, then you can't go through the citric acid cycle, which creates all these things we need. And if you look, NAD plus enters here, NAD plus enters here, NAD plus enters here, right? So if you don't have, so if you take nicotinamide riboside, you're gonna have all of the cofactors you need to do this whole cycle, which is what's needed for tons, the whole basis of our body is, energy production needs the citric acid cycle. So if you look right here, here's the electron transport chain. It happens in the mitochondria, which is why we say mitochondrial dysfunction. It means you will be lack of energy. The whole purpose of this electron transport chain is to pump these hydrogens into the intermitochondrial membrane. See, intermitochondrial membrane, and then the end result is ATP right here, okay? But if you look, you have NADH right here. You have, they're not showing CoQ10, but that's right in here, this area with cytochrome C. And so there's many places things can get messed up in here, but nicotinamide riboside is going to help with this first step in the electron transport chain, which helps raise energy and do a lot of other things. So here's an article that had talked, and I have the reference in the back. This is the mitochondria. This is what creates your energy, gives you ATP, and the nicotinamide riboside helps with that. So here it is a form of B3, so it's a B vitamin that helps with energy metabolism, and I explained why with all those pictures. It helps with the Krebs cycle, citric acid cycle, and then it's believed to boost NAD+, which I talked to you about right here, NAD+, which is in that cycle 3 different times. And by increasing NAD+, it may theoretically support mitochondrial function. And so hopefully I gave a little bit of background on that without you taking a whole course. So here's some NAD. There's all different kinds of nicotinamide riboside that I recommend that are bioavailable, that are good. This one costs like $1 gazillion, super, super expensive. You can, and I don't see any reason for it to be that expensive. There are other ones that are less expensive that do the same thing that I really like. This one has some other things in it, like psilocybin. I can't pronounce it very well, but it has some other cofactors that I find work well, and it's like, 1/10 the cost of some of the other ones. So that's the one I usually recommend for people. But anyway, there's all different kinds. Okay, detoxification. You gotta detoxify any of the mercury that's in your system, or any of the other things that are in your system, including viruses. So we're gonna go through that. I highly recommend for people with chronic fatigue, if you think toxins in your body accumulation might be contributing to it, is use zeolite. And this is, zeolite is basically like a dirt, really, right? And it has a structure that binds to viruses and to bacteria and helps you get rid of them, and toxins. And so, like, I had a woman who had, for years, really, really bad vertigo, right? And she thought she had gotten it in while she was in the military in Iraq, after she got a flu and some weird illness. So I thought a virus potentially had gotten embedded in some of her ear areas, which was causing her to have this vertigo imbalance. So I put her on this for 60 days, and she just took 1 tablespoon in water, stirred up, and drank it for 60 days, because that was what the protocol that I had read said that will slowly get rid of embedded viruses like Epstein-Barr virus and other viruses that are stuck and embedded and hiding out in certain tissues, and it will chelate it out, slowly over time, and it worked. And she had tried everything to get rid of this vertigo, which was incapacitating. Like, she'd fall over and wouldn't be able to get up, and so I've had some great luck with getting rid of viruses. This is an easier form to take. It's a little bit more expensive. I think I have it right here. Here it is. And you just spray it under your tongue. Once again, you let the mucosa in your mouth absorb it. And it doesn't taste like anything. It tastes like water. And it works really good at detoxifying. You only need to do like 6 squirts a day. It's great and easy to incorporate into your diet over time to slowly chelate toxins out of your system. All right, another thing, this is more explanation for you to read at your leisure of why and how zeolite works, okay? How does zeolite, clintopolite is that powdered form of zeolite, you know, how does it actually pull viruses out of your system and toxins like metal, like mercury, metal ions, right? These are the studies that talk about it, and there's a lot more. Here's another review. This is taking all the published data